what you're trying to do is you're trying to recreate the same thing as you did for the posterior aspect, for the anterior aspect. Okay, so when I push the hip down like this, what happens in the back? It'll start pulling, right? So what you're trying to do is you're trying to make those muscles pull the hip back to its original space. Okay? So you hold the hip, you hold the leg, you push as much as you can, and then... Okay, if this leg comes up, okay, and if it doesn't go through, you can actually hang the leg out. Okay, to create... Yeah, you move them to the side of the table, and you'll hang this leg to create more of a pull. Okay, this is a harder technique to perform. Okay, different people do it differently. Some people turn on your side towards me. Some people, you know, they'll create. Switch this. They'll pull, and then they'll bend. And then, you know, they go here. Once they go here, but you gotta make sure not to hit them in the chin.
Yeah.
Okay?
Okay, good.
It's a very hard technique to do. The easiest one that I have found that works good, just to pull the hip back. Okay? Any questions about what we've done so far? About any of the movements?
Did you say that we have to do the anterior and the posterior?
It'd be good to know, of course. You become a doctor, right?
Oh no. When you actually do the treatment, do you
No.
do both, or just?
When you're doing a treatment, okay, in acute cases, it'll be very obvious. Once you put the joint back, you just leave it there.
Okay.
Okay. Now, in chronic cases, you might want to stabilize the joint, not stabilize, move the joint. So you might do anterior and posterior. Okay, because in chronic cases, it's not that the joint is out, it's the ligaments that are inflamed and chronically inflamed, and there's scar tissue all around the joint itself. So you want to do a little bit of movement. Okay, so yeah, you might want to do both of them. I do quite a lot. Okay, let's turn on your stomach. Now, with piriformis syndrome, okay, the way you check for piriformis syndrome is it's very simple. It's a true pain in a butt or in a buttocks. Okay? This is where the pain starts and it shoots down. Symptoms are global. Why are they global? Come on, we've talked about this today. Why would piriformis syndrome be global symptoms? Because it's compressing the entire sciatic nerve. Okay, so you stretch the piriformis in order to see if it's positive or not. If you compress in the piriformis, which is going to be painful, and you stretch, and it recreates the symptoms, they go, ah! Okay, it's piriformis syndrome.
And it would recreate them all the way down the
Yeah,
leg.
all the way down here. Okay, or some people just will experience pain, sharp pain in here. Okay. Let's take a break and then we'll come back and do the piriformis and the hip. Okay?